Chapter 11, Antifungal Agents. When I think of antifungal agents, I typically think of athlete's foot, or I think of random mushrooms growing in my yard, or I also think of the fungus that is the Candida that can cause yeast infections or thrush through the GI tract. A quick overview of how fungus differs from bacteria is that fungus is composed of a rigid cell wall made up of chitin and various polysaccharides. It also contains a cell membrane. The protective layers of the fungal cell make the organism resistant to antibiotics. Fungus is caused by mycosis, and when I think of the most common type of fungus we see today, or that I think of, is the Candida, which is a fungus that is normally found on mucous membranes, but can cause yeast infections or the thrush, the white tongue, and the white sores in the mouth, and the GI tract, or they can get yeast infections in the vagina and have vaginitis. When we think about drugs therapy across the lifespan for fungal infections, we want to remember our pediatric patients. They're very sensitive and can have severe reactions. Adults, antifungals can be very toxic to the body, so we want to make sure we have identified the organism before we prescribe it. Pregnant and nursing women should not use these drugs unless the benefit outweighs the risk. Topical agents should not be used over open or draining areas because it can increase systemic absorption. Patients with AIDS are more susceptible to fungal infections, along with patients who take immunosuppressants. In our elderly patient, we want to watch for hepatic dysfunction. If they have poor hepatic dysfunction, possibly from alcohol abuse, we may need to lower the dose, so be aware of that. Also, many of these agents can cause renal toxicity, so we always want to assess the renal function. When we're prescribing these antifungal medications, many of the drugs that are used treat systemic fungal infections. So we want to get a culture, and this needs to be obtained prior to starting the antifungals. So just be aware of that. We need to identify the agent before starting. The next area we're going to cover is systemic antifungals. And they're broken down into two classes, and then there's four that really don't fit into a class, and we'll discuss those two at the end. So the Azoles antifungals are a large group of antifungals used to treat systemic and topical fungal infections. Common ones that you'll see in today's practice are diflucan, which is called fluconazole. I can never pronounce these, sorry. And another one is terbinafine or Lamisil. These are less toxic than other antifungals. It's rapidly absorbed in the GI tract. And we want to watch for patients who are contraindicated with hepatic and renal dysfunction. And also we want to watch for medications that cause a prolonged QT interval, which is seen on an EKG, which ondansetron, or also known as Zofran, can cause that. Adverse effects, we can see liver toxicity or tetragenic, which is in pregnancy. We want to, when we're giving a drug-to-drug interaction, we want to watch for patients who are on oral anti-diabetes or anticoagulant oral medications. The next one we're going to talk about is eco-candid antifungals. One of the types is anadolafungin or Araxis. And this treats candidium, which is an infection of the bloodstream, and it's given IV. It's also used to treat intra-abdominal infections. These drugs are all given IV form. And we want to assess for hepatic and renal dysfunction. They're at risk for liver toxicity and at risk for bone marrow suppression. So we really, on both these, want to watch for their liver function. These next few drugs you definitely need to probably know for your exam, or at least a few of them, but you'll have to know them all to study for. The first one we're going to talk about is caspofungin. It's approved for the treatment of invasive aspergillosis, and which is a lung infection, a yeast lung infection, for patients who have failed other refractory treatments. The next one we're going to talk about is fluclocytosine, or Ancabon. It's a less toxic drug used for treatment of systemic infections caused by the Candida or Cryptococcus. And that's just a yeast infection. The Cryptococcus is a yeast infection typically found in immunocompromised patients. This is only given IV form. It's toxic to the liver and kidneys and can cause bone marrow suppression. So when we give this one, we don't want to give it with anti-neoplastics or corticosteroids. The next one I'm going to talk about falls into the other antifungal group as well. And this is used for treatment of intestinal candidiasis. And it's available in many forms. It can be given oral, or it can be a topical preparation as well. You can give it as liquid, typically for the mouth if they're developing some thrush. We give that. So yeah. The next one we're going to talk about is diflucan or fluconazole. It's the treatment of candidiasis. We give this a lot prophylactically for reducing risk in bone marrow patients. So for our patients developing thrush, we can give them some diflucan. They have a horrible yeast infection, we'll give them oral or IV diflucan. The last one on this slide I'm going to talk about is terbinafine or Lamisil. This is used for treatment of that nail fungal infection. And your diflucan and your Lamisil fall under the Azoles antifungals. This next one I'm going to talk about falls in its other class as well as amphotericin B or Albacet. And this one is very potent. And it's reserved for progressive potential fatal fungal infection. It is only given in IV form. And you will see that probably come back to haunt you. That is only given in IV form. We don't want to give this to pregnant ladies or patients who are breastfeeding. We also do not want to use this for patients who have impaired renal function. It's very toxic on the liver and kidneys. It can cause severe renal impairment along with bone marrow suppression. We want to avoid using this with nephrotoxic antibiotics, anti-neoplastics, cyclosporin, and corticosteroids. So just remember that this one's for progressive potential fatal fungal infection, and it's only given IV form. When we are caring for patients who are receiving systemic antifungals medication, we want to assess their allergies before we ever give this. We also need a good history of liver or renal dysfunction because it interferes with the metabolism and excretion of the drugs. We also need to be able to identify if the patient's pregnant or lactating because it can have adverse effects to the fetus or infant. We want to obtain a culture of the infected area to make an accurate determination of the type and responsiveness of the fungus. We want to get those lab works done, renal and hepatic function studies, because when they're on it, we want to see if it's affecting those organs. And these medications, these antifungal medications, may take up to 6 months to treat a chronic condition. We also want to provide small, frequent, nutritious meals if GI upset is at risk, and may need a dietary consult. So be aware of that. The answer to this question is yes, it is true. And nystatin or mycostatin can be used for the treatment of intestinal candidiasis, and it's also available in a topical preparation, which we'll go over next. The last topic of this chapter is topical antifungals. Some antifungal drugs are available only in topical forms for treating a variety of mycosis of the skin and mucous membranes. These diseases include a variety of having ringworm, or they could have athlete's foot or jock itch, or a yeast infection in the mouth and vagina, often caused by Candida. Sometimes it's better to use topical agents because the systemic is too toxic when we're getting close to open or draining wounds. These do include the Azoles topical antifungals, and then there's the other topical antifungals. These work by preventing cell replication. These drugs are not absorbed systemically, and there's little contraindications or limited known because they're not topical. When you give gentian violet, it stains the skin like a bright purple. You can buy it over the counter. I've used it like on a wart. But it doesn't say it's for that. When adverse effects is they are applied as a cream or lotion or spray, they can have irritation, burning, rash, and swelling at the site. If you give a suppository, the patient can complain of nausea, vomiting, and possible have hepatic dysfunction, or urinary frequency and change in the sexual activity. When we have nursing considerations for the topical antifungal agents, we want to know their allergy status. The physical status, we want to know if there's any culture and sensitivity done on the fungal that we believe the patient has. Before we apply the topical cream or antifungal agent, we want to assess the area of application for color, temperature, and evidence of lesion. We need to educate our patients to take the maximum course. When we're applying this topical cream, we want to clean with soap and water before applying. If it goes in the mouth, we need to let it dissolve slowly. If we're giving a vaginal antifungal medication, they need to remain in dorsal and recumbent position for 10 to 15 minutes after insertion. If a severe rash occurs, they need to stop the drug and notify their healthcare provider. Do not continue to use it. So we always want to assess the area before we put on any topical antifungal agents. So when we think of topical antifungal medications, the first one I think of is clotrimazole or Lamotrigine. It's going to treat the ringworm. Often, two of my college roommates got this because they had newborn kittens in the room and the newborn kittens weren't clean. Another one you'll see is miconazole or monostat. This is treatment of local topical mycosis. It can also be bladder and vaginal infections. We'll be treating Genetian violet. Topical mycosis, just that topical mycosis looks like dry, patchy skin that has a little fungal infection on the skin. You can put that on there. It stains the skin. It's supposed to kill the fungus. The next one I think of is tolnaftate or aftate, and it's a cream. They're all topical. It treats athlete's foot. So all four of these are topical, and really you just want to know these are not systemic. We don't really know if they're contraindicated or anything, but they're a cream, so they might have some burning and irritation, swelling at the site. So be aware of that. Next, to discuss different prototypes. This next one is fluconazole or diflucan. We give this a lot for systemic fungal infections. And just remember, it's metabolized in the liver and excreted in the urine. So what lab work do you think you want to assess? Probably your liver and renal function tests. Patients can complain of headache, nausea, vomiting, diarrhea, and abdominal pain. They may verbalize that they have a rash. So you want to culture that if it's an open rash or wound. And also, if they're having nausea, vomiting, diarrhea, and some abdominal pain, you want to offer small, frequent meals. The nurse is caring for a patient with a fungal infection. Which of the following would be considered an adverse reaction of a topical antifungal medication? The answer is A. The patient can have burning or irritation of the sexual partner. They can have nausea, vomiting, or abnormal liver function test. If it's topical, though, they can have stinging, redness, edema, and then the vaginal area, they could have lower abdominal pain, urinary frequency, burning or irritation, and a sexual partner. In conclusion, when I think about medications, we know the systemic medications I put on a separate slide. Those will be important to know for your exam. I won't exactly say it's an Azole or echinocandid or other antifungals, but know the few meds I discussed. You need to know the treatment, kind of what it's used for, what side effects are pertinent to that medication. Is there any lab work testing involved? Possibly two, liver function test and renal function testing. If we're giving topical medications, we need to know what's important. If we're giving it for thrush in the mouth, we need to focus on a good oral care. If we're giving a powder form onto abdominal folds, we need to do a good thorough skin assessment. When we are giving fungal medications, we need to identify patients who are immunocompromised because they're more at risk. So that might be a patient who has AIDS, a patient who takes prednisone, or is on chemotherapy, or is a diabetic patient. So just be aware of those as we practice that. Patients who are immunocompromised, we talked about drug therapy in the older adult, and the children, they're also they're not necessarily immunocompromised, but they are more sensitive to these medications since we don't do testing on pediatric patients. Also, we don't want to give these to pregnant or lactating women. We need to outweigh the benefits, clearly need to outweigh the potential risk when giving this to the fetus or neonate. So be aware of that. If patients who are who are of childbearing age, we need to educate them to use contraceptives while they're on this medication.